Yes, yes, yes.
So, okay, Bharati, you can ask
Uh,
something so that she will also listen. And
yes.
in between that, if
Mm.
she thinks that yes, it is resonating with her also,
Yes, yes,
so
yes.
you can ask something
Yes,
so
yes.
that I can address it.
Main stress is the time management. Yeah, yeah. It's we'll arrange a session on time management, isn't it?
Yeah,
It's
yeah,
time
time
management.
management. Uh, and okay, so here she has written. So that is why I'm telling. Sometimes what happens? People try to procrastinate, right? So why this procrastination and why this time management becomes a challenge? Lots of work, but 24 hours is for everybody. There is no exception. But the thing is this: we on day-to-day basis we are not paying attention how much time we are spending with each and every activity. And especially nowadays, the most distracting thing is our gadgets. That I also personally feel. So whenever we are using the social media, the time goes. It is not that we are just messaging somebody or some good things even. Yes, yes, of course. Because at the end of the day, irritation comes. Why irritation comes? Because we know how many tasks we need to complete. But when we see out of say 6 or 7, we could complete only 3 or 4. Remaining 2 or 3 is pending. So it is carried over next day. So next day doesn't mean I am free. Next day more works. So these are the additional works. Now 24 hours, again the same thing. I have to take some time for my personal, at least eating, bathing, rest. These are very much required. So the first thing is this: we need to pay attention. What are the uh, what are the activities we need to do in the daily basis? Morning time or before we sleep, if we take some time for the next day, what are the works we need to do tomorrow? We can list few works. Again, next day, maybe certain works which are unexpected again came, which are urgent, maybe important. Sometimes some works are not urgent but important. So how to segregate it? There is an entire uh, uh, logic we need to understand. So while we'll do this time management workshop or webinar, we'll discuss that very logically. But today, as just an instant tips, we need to first figure out what are the works we need to do next day, or next day morning we can list some work. And we need to see, we need to watch what are the activities. Say somebody called. Hmm? Somebody called, some friend called, and I took where I used to take 5 minutes, I'm taking it 20 minutes, 15 minutes extra gone. So, what I do generally, I use Bluetooth so that I can continue my other works and this time is saved as well as I'm attending and addressing these things. So each and every activity throughout the day, whatever we are doing in workplace, at home, even simple going to washroom, how much time we are taking. Sometimes we are lost in thoughts. We are lost in irritation. We are lost in self-blame. We are lost in blaming others, blaming situation, unable to do it. And we are not conscious enough that we are losing our time. Time is fixed, 24 hours, it cannot be stretched. So while doing each and every work, we need to focus that how much time we are spending. The first step you can start. Becoming aware, becoming conscious. So if you start this much of work, many of your problems will start reducing. Even if this irritation happens, you need to address why this irritation is happening. Sometimes it is not that we are not machine. 20 minutes I have to spend, just 20 minutes. If it is 22 minutes or 25 minutes, oh my God, what, how can I finish it? How I'll do the other works? You need to pause and just say, it's okay. It is also an important work. I need to do it. I need to attend it, no matter 5 minutes extra, even 10 minutes extra, I will adjust it. Even if at the end of the day, I understand that some works is pending, still, if I can convince this one, it is very, very important. We are now concerned about first this one. While I say this one, it is not a selfish thing. Oh, should I think about myself only? Why myself? If this one is moderately fixed, when I say moderately fixed, that means the thoughts, emotion, what is being produced here. Because some, as for example, somebody told something, but against that, what are the thoughts I am creating that is being manufactured here only? That is why we need to address this one. Our thought, our emotion, our words, our action, this is 100% with this. So if we take care of this one, what this one is doing, what this one is expecting, even if the midst of chaos, even if extreme challenges, then 90% work done. Irritation will not come. Your stress level will be reduced. Your sometimes we get scared. Oh my God, what will happen for the children, for family members, for workplace? What if such thing happens? Anxiety arises. We can take care of the anxiety just fixing this one, just taking charge of this one. While I say this one means what are the thoughts, emotion, words, action is happening here, because this is only in our control and nothing else. So our attention should be here only. So whenever you are paying attention on the daily basis, you will miraculously see that many problems are reduced, because you are in a position to address the problems in a more effective way. You can give more impact what you want to do. So like this is called awareness, consciousness, and we can cultivate this awareness. There is a practice which is called mindfulness. Have you heard this word mindfulness, Ridvinder? You can type also. Good evening, another person joined, Sharbari Pal. Very good evening.
Yes, Sharbari Pal, she is my friend. She is from Silchar only.
Okay.
May I add two, 3 lines for Ritvinder?
Yeah, sure.
Okay. She's Ritvinder, you are there, no? Hello? Ritvinder, are you listening?
Yeah, I think so, but she's typing or something like this.
Okay. Because voice is not clear. Sharbari? Hello?
Yes, ma'am, I'm listening.
Okay.
Yes.
Then 2-3 lines just I like to add according to your first questions. As you asked na, how to manage time. Now, I like to add just 2-3 lines according to ma'am's description. Okay, if you are very much in the morning, if you make a to-do list, okay, what I am supposed to do today, and according to that, you should understand okay, what is my priority of the work, which work I should do first, and which one second, which one third, which one fourth, and according to that, you will have to allot time. Suppose 10 minutes, 15 minutes like this, so that by 10 or 11 you can finish your all household work and all work, and after that you can leave. So the pre-planning is very necessary. You are supposed to make the plan. You will have to make the plan. Suppose tomorrow I'm supposed to do today. If you make the plan little bit, and then if you execute the plan, then you will see nicely you can manage. Because sometimes what happens in the morning, we start what I'm supposed to think, by this we waste 10-15 minutes like that. So according to my experience, because I am supposed to handle so many things per day, so I'll suggest to make a list what you are supposed to do. Then priority wise, you write it down in a paper, and after that you try to implement. You will see you will be able to cover more topics than initially suppose you are not making it. Is it clear? And if suppose something happen, suppose somebody is saying something, and if you think on that particular matter continuously, then your other works will be disturbed, and it will take more time to finish. So what ma'am is saying, you should be very much aware of what you were doing. At that time you'll see that you can manage time nicely. You will not face any problem to manage time. So if you are very much aware of okay, what I am doing, then, and if you do it with your effort and this without thinking other things, whenever you're doing which work, concentrate on that only. Don't think others, then you will be able to finish it at the right time. Okay, am I audible, Ritvinder? Today's network problem is very much
No,
there, I
no,
don't
Yes,
know.
ma'am. Yes, ma'am. Yes, ma'am.
Yeah,
Okay,
yeah.
okay, okay, yeah, because voice sometimes it is not coming. Shorbudi, hello. I don't know whether she is able
No,
to
no.
listen.
I think her audio is not still connected.
Oh, yes, yes, because
Yes, Ridvinder, you are absolutely correct. Mindfulness means being aware of something which is going on. Yes. Multitasking. Now the question is, what are the multitasks you are doing? Uh, Research shows that multitasking, yes, multitasking is not a productive thing because uh, we need to focus on a particular work, then it gives quality work, or the it will be more productive. Whenever the tasks which we are taking as a multitask, हाँ, correct, ये भी हो जाए, वो भी हो जाए. That is why just Bharati ma'am told that you need to give the priority, because this is also an important work while you are making the to-do list the morning itself or the prior one day. Which work first according to the priority, and assigning approximate time. So that is why you need to unclutter yourself, how to manage all the works. Yes, main hindrance in positive progress and efficiency in one part. Yes, actually. So that is why you need to convince yourself, give priority, which work is important. So in our time management workshop, we will explain in a very systematic way, depending upon the urgency and importance. Some works are urgent but not important. Some works are important but not so urgent. How to assign it, how to select, and how to give the importance or give the priority. And the most important thing is this, if you are aware of each and every task, whatever you are doing, how much time you are taking, you will be able to finish. And moreover, again, I repeat, keeping track of this mind, how this mind is responding. If it creates irritation, ye nahi hua, wo nahi hua, that means you will lose time. Because whenever irritation is produced, you will anyway will do in your below capacity level.
Performance level will decrease.
Yes, always,
Yes.
always.
Yes.
And that is why when irritation comes, we will do mindfulness workshop as well, how to take charge of the irritation. Whenever irritation happens, probably you have noticed that there is some bodily sensation happens. So the moment you understand this irritation arises, that means you need to catch it. Why need to catch it? Because it is going to kill your time. It is going to reduce your productivity. It is going to destroy your potential. So that is why you need to catch it at that time and take charge of the sensation. We start that process from the bodily sensation, reduce the bodily sensation. We come to this awareness level, what to do. It's okay. We can convince ourselves it's okay. So that is how we progress in our life. And ultimately, we find that a personal growth happens. The person which you and I, before say last month, whenever you are taking this charge, after 1 month, you will see that your potential is being utilized, your mental freeness is there, a sense of satisfaction is there, better time management. If you can manage your time better, you can manage your stress level also, because lack of time management is one of the source of stress. Anything else, Bharati, you want to
Yes,
clarify?
no. So yes, that means if she can manage her time properly, then stress will also reduce.
Yes, because
Yeah,
one
they
of
both
the,
are
it is
directly
not,
related.
yes, it is one of the other reasons are there. It is so time is one of the, because the works, most of the people who are working in good, this post, they have to work for number of hours, and moreover, especially for ladies, at home also responsibilities.
Family
Uh,
responsibility.
yes, household chores,
Actually,
children are there.
yes. Actually, what happens if you think I am not able to finish it, two, three left due to this, whatever that you're thinking, oh, I am not able to do, I'll not be able to finish. By thinking, we are wasting time and we are getting conscious, and as a result, other works are getting hampered. If you don't give attention, okay, let me finish whatever I can, it is better, and quality also increases.
Yes, yes. So when we get the quality of work, we anyway
Mm.
we get a satisfaction that it's okay if we are doing 3 works instead of 5, but I have done it completely. Satisfaction is very important. It matters because with satisfaction, we have got a joyful mind, and with the joyful and the
Yes,
satisfied
yes, that
mind,
is required. Joyful mind, quality
yes,
increases. Quality of
quality,
work increases.
yes, yes, yes.
Because if
Quality
you
of
do it,
work
mm,
increases, quality
yeah,
of relationship increases.
time requirement decreases.
Yes, 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 of course. So many
Of
things.
course,
So
how
these
many
are
things.
the skills actually. These
Mm,
are the ultimate skills. But all these things, unfortunately, these are not taught anywhere. In
no,
our school, college, university curriculum, these things are so important in our life, and which is going to determine our quality of life, quality of relationship, and quality of our physical health. This is one of the reasons why people are suffering from so many diseases. Unfortunately, while making the treatments, the source is not addressed. That is, I'm trying to give the message to every people. Whenever people are going to doctors, having any of the problems like high blood pressure, high blood sugar, cardiac problem, any kind of things, stress level is there. So
Hmm.
even if I am taking the medicines, where did we address the root? If we see
Yes.
a plant, the plant is not in a good condition and we are just watering on the leaves, not roots. So can we expect the plant to continue to its good health? So the similar
Hmm.
manner is our human body.
Root
A
is more important.
root is
Hmm.
more important. Where from? These things are,
Hmm.
this cardiac problem are coming from where?
Well,
What
actually.
is the root? Unfortunately, these roots are not addressed. We are taking medicines, and with these medicines, pharmaceutical companies are becoming multi-billionaire. Let them grow. But the thing is this, are people living a good life? So
No, no.
what it is important is this, that if we want well-being, we need to address what is going on within ourselves. What are the thoughts? What are the emotions? What is going on and why? And are we ready to address this? So these are the questions we need to ask.
Exactly. Yes. Most of the
But
people are suffering from this time management, and as a result, stress
yes,
management. Both are. Most of the people are saying that they are not able to manage the time. As a result, stress is also developing. So
yes,
if we can suggest, no, there's ways how to manage the stress, because the root cause of all the diseases,
mm,
most of the diseases, if you take the investigation, you will find the root cause is lying in the stress. And stress is again directly related with time. So people
mm.
are not able to manage time. So the main
Time,
training is required
yes,
in time management.
yes,
Exactly. This is my opinion. Mm.
along with time,
And
there are
other factors also. Yes,
other,
like
other
resilience and all.
very important factor is this
Mm.
acceptance level. We sometimes, not sometimes, many a times, we cannot accept the situation. We cannot accept what the others are doing. We cannot even accept ourselves also. Sometimes we become frustrated with ourselves. Why this one is not functioning? So this self-acceptance level is also very, very important, that we should accept ourselves. We should learn, we should train ourselves how to accept others, how to accept the situation, and then how to handle it in
React.
the best possible way.
Yes. And to react it accordingly.
Not react, respond it.
Responding. Yes,
And
yes.
that is why I said yesterday,
Mm.
if every adult, those who are not adult, for children it is not possible at least,
No, no.
those who are adults, if we think that my life is my responsibility, responsibility means the ability to respond. If we do it properly, then everything falls in the right place over a period of time. But we need to take care. We should be aware what is happening, how to change it, how to make the necessary changes. That is what. And for this, in our psychotherapy, the most effective work is called journaling. To take a notebook or a diary, writing how was the day, what are the difficulties I faced today, each
Yes.
and yeah, difficulties I faced, or maybe I did some work wonderfully. That also you can write. You will get the motivation. And where you could not, let me see how can I manage it? How can I do it? How can I handle it tomorrow? What are
Yes.
the strategies? So whenever you handle your irritation, then only the strategies will come out of your head. So journaling, and one more is some breathing exercises
Yes,
every
yes.
day.
It works.
It reduces our stress level. It
Yes.
reduces our anxiety. What is anxiety? Anxiety is nothing but it is not happen, but we are thinking that it
Hmm.
may happen. So it is absolutely a energy draining thing. We need to take care of anxiety. But again, anxiety is is a pattern that we are trained actually. If you see those who take anxiety, it's a pattern we have learned, we are trained in some point of our life, and that point is our childhood.
It reflects it in adulthood.
Yes, and it is more than scientists are telling that more than 50% it is genetics. It is carried over with our genes. Now the question is, if it is genetically, I have seen my parents also to take anxiety. So how can I handle this? Yes, you can handle this, even if it is a genetic one. You cannot change your genetics. You cannot change your parents, right? But you can change the influence of your genetics. There are processes.
Yes,
The,
yes.
the processes are the continuous, and the best way is a mindful living. That is why I
Hmm.
stress on this mindful living. Mindful living actually gives the solution of everything. Through mindful living, you can redesign your destiny, I can say it. Now, destiny is what? Destiny, we are creating it every day. It is not that pre-decided. We are creating destiny every day. How? Thought creates destiny. Each and every moment we are thinking something. If we are not uttering those things, how we are thinking, what we are thinking, how we are feeling accordingly, and we are creating our future. And we are many a times, many people are not aware of it. So through
Exactly.
mindful
Because
living,
yes, yes. Mindful living, yes.
so through mindful living, we can change our destiny itself. Because it is not that you have to believe me, you need to experience it. Because I experienced it number of times that what we can't change. Because if we know the power of mind, just Bharati ma'am was telling that she was reading a book of Swami Vivekananda. The power of mind is such a huge one. It is not for me and Bharati. It is for every human being. We are blessed with such great potential. We need to tap. The only thing is this, how to tap, we need to know the steps.
Yeah, exactly. Hmm.
Uh, have you heard? Acha, now Dr. Amar
Okay, Dr. Amar here. Okay.
has
Amar
joined.
was also my student in army school. Hi, Amar. How are you?
Hi, good evening, ma'am. How are you? How are you?
Good. Fine, fine, fine. Absolutely fine. After a long gap, I'm so happy, excited, and happy to see
Yes,
all of you.
yes, seriously,
And
ma'am. I am
congratulations, and
very glad.
congratulations.
Seriously,
That
thank you so
you have
much, ma'am.
become a doctor.
I'm really glad that I
Welcome,
am
sir.
meeting.
Welcome, welcome. Finally, you are free from your IES center.
Yeah,
And
I
we are,
actually wanted, ma'am. Actually, I wanted to join you yesterday, but I couldn't. I was
I
just
understand.
busy with my.
I
Madam
understand.
said,
I understand.
Madam said you have to correlate your this what do you call your daily full activities, and you have to note it down after in a brisk manner so that your anxiety levels. But it's very impossible for a medico, for a doctor like me to operate 10 surgeries, and among the 10 surgeries you land into complications, and you turn out those complications into mortality also. So that is a very, very tremendous pressure over every medico in my. I am talking about in my field, and you. It's very difficult that you write down those things and you just avoid the trigger. The trigger is like the anxiety, which madam is 100% right that this trigger can be avoided by just changing the environment, just changing your mindful thoughts. But it depends upon the professional activities of a person. In a field like as a surgeon, I do onco surgeries. That's a very difficult surgeries for me to operate, and to lose a patient is one of the very important aspects in my. I have lost a lot of patients. I've saved
Yes.
a lot of patients.
Mm.
So it's very difficult, because your endogenous hormones are changing. Your body has a hormones that are stress hormones, counter-regulatory hormones. That
Yes,
counter-regulatory
yes.
hormones, they have a circadian rhythm in the body for the 24 hours. They keep on changing. Even if you try to manipulate those hormones, you try to change your environment. It's very
Mhm.
difficult, madam. It's
Now,
very difficult.
Umar, just to tell me, do you practice whenever you are doing this surgeries or whatever? Do you find any disturbance? I am doing this, but I am getting influenced by some other thoughts. You are operating, but is there any type of other things comes in your mind at that
No,
moment?
absolutely. No, absolutely not. Even if I fight with my wife before leaving the hospital, definitely I will not keep that in mind.
No, not fighting with your wives. That is so you're just
Madam,
joking.
that
I am
Why
is
just
you have to
that.
asking.
fight? But why do you have to fight with your wife? Who is
Def-
looking after your home? Who is looking after your daughter?
No,
Who
no,
is looking out of
he's
your
just
things?
joking, I think.
he
No,
is
no.
doing no. It's
Even
just
I
a.
am also
It's
pulling him, ma'am. बत्ती सालों बाद मौका मिला तो I'm pulling him out.
हाँ
uh,
नहीं
So
नहीं अमर
actually, ma'am,
ना
actually
हाँ
for me, these things does not matter at all. Even if my word for this thing it's just a prank. I just introduced myself in this. So whenever I operate, because in a operating room, automatically it's not only me. It's not only with me. It's like with every surgeon who is operating does not remember anything except his patient that time. It's very common with every medico, especially the
because
surgeons. Yes,
you
yes,
can
yes.
concentrate in the other types of any types of thoughts do not disturb you,
Yes,
isn't it?
because
You can
exactly
stay.
because ma'am, because the threshold of the doing surgery that time over exceeds the stress of other things that you have
Mm,
left back behind the OTs. This is exact because once you are operating, you are holding a hand, you are holding a patient, you are holding a life. Even
mm.
if you keep things wandering inside your mind, then you keep operating those things, and it will be disturbing moment, and you can lose the things. Point.
Exactly. I do understand. But yes, whatever ma'am is saying, she will answer your questions.
Yes,
And what she will say that what she's saying a mindful living. Yes,
yes,
yes, she will
yes,
just reply.
yes,
Just wait, she will
yes,
reply.
Dr.
Please
Ramar,
continue.
you are in such a responsible job. Huh?
Mm,
So the
mm.
anxiety level is a natural byproduct.
And I'm
But
every day. It's
yes,
very
every
Every
day.
day.
it's a bread and butter. It's a bread and butter for me.
Yes,
Yes,
yes, yes, I understand.
but you will have to save yourself. Otherwise, you will not
Yes,
be well. You have family also. You are a
you,
doctor, then above all, you have the family also. So if you get disturbed by these things, then you will not be able to enjoy your family life also. So
and
both there
Very
should be
much.
balance and how to balance.
Ma'am,
Yes.
I
What
have,
otherwise you will lose this one.
you are very much. I have just maintained kind of a timetable for this. I usually do a daily activity. I mean, I just do activities. I will tell you, I'm just flowing with all of the stress activities. Daily, it's a daily part and parcel of my life. And
Yes, yes.
point of joining your lecture was that I just really, the topic is very, I don't know why other people have not joined. This is a daily day-to-day activity which madam has spoken very beautifully.
Yes.
I, ju-
And
I
when
really
we discuss,
appreciate this topic.
yes. Yes. And as a
okay.
doctor, we are very happy that
Yes,
we are
yes.
accepting your advices and your opinions also. So that is really
Definitely,
uh,
important. And just
definitely,
listen.
ma'am. Definitely,
yes,
definitely, definitely.
yes.
Mhm.
Dr. Amar, I'm just asking just a question. While you start your day, just get up uh, from your bed. What's the first thing you do?
Ma'am, whenever I start my day, means it depends upon my schedule. At what time I have to start. Usually, I prefer morning times because I pray. This is the first thing I do.
Pray. So,
Yes, this is the
how
first thing.
many minutes generally you take to pray?
Ma'am, it takes me hardly 15 to 20 minutes to pray, not more than that.
Okay, no, 15 to 20 minutes is more than enough. So, what I request you from tomorrow, one more thing you add while you pray. just make visually, just visualize the entire day, whatever the works you are doing, you are attending your patients, you are making surgery, complicated surgery, different complexities. In this 15 minutes or 20 minutes of these things, divided this prayer 10 minutes.
Okay.
10 minutes, just visualize the entire schedule because you know what the patients are going to come because it is P-fixed, right? This is the surgery, those patients will come more or less, isn't it? I am
Yeah, definitely.
attending each and every patient from your mind because our mind is very powerful, very, very powerful that we ever imagine. I am attending each and every patient. I am doing each and every surgery. You can feel the instruments in your hand. I am doing it so successfully, and my patients are so happy. Each and every patient, each and every family members are so happy, and I am grateful to God because God is giving me that patience, that capability. Just visualize the entire day, and I am doing it with in time, just free of mind and absolutely in a focus state. We can program it. This is called a programming. We program software. This is a in human body. This is a complicated software is there. We hardly pay attention to this. Once we pay attention to this complicated software, we can do many things. Anxiety will disappear. I can promise you. Just to
Without
pay
Yeah, you're
attention.
right.
anxiety.
You are right. You are right, ma'am. You are right. You are very
One
much
more
right.
thing you can do for anxiety, just before you do your surgery, say one surgery to another surgery, go to your cabin, take 1 or 1.5 minutes maximum, uh, beyond that it is not needed. Place your right hand on your chest because these are all scientifically proven, and left hand on your abdomen. Just pay attention to your breath, your bodily sensation. Half minute, you will see you are coming down. There is no question of anxiety further because you know your anxiety is reducing your potential, your capability. You are underperforming it. Due to this, you should take this 1.5 minute, 90-second maximum. You can take 80 seconds also or 75 seconds. Make this one completely present and free of anxiety. And how? There's the wonderful technique is observing breath. And whenever you are placing this hand to your chest, this is the wonderful, it functions wonderfully. And the left hand on your abdomen, just focus on your breath, this 60 seconds, and rest 15 or 20 seconds. Just focus. I am going to do the next surgery. I'm fully focused. I'm fully confident I will be able to do this beyond my imagination. Have faith on yourself, faith on the superpower. You will find everything in a magical way. Because why I'm telling it? Because magic here lies here. We are hardly attending this magic. Because since we are not attending the power of mind and the magic within us, that is why all question of anxiety comes. Otherwise, it will disappear. Dr. Ramo, do you agree?
Great. I do agree, ma'am. I definitely agree. But
No,
I'm
no, no,
so,
no, Amar. Without
Okay,
practicing, you can't.
no.
You
Let
can't
him
fix
tell.
it
Just,
for today.
I want to listen. Just
I,
continue. Just continue.
nahin, madam,
Uh,
with due regard, I do definitely 100%. Madam is very much right. But actually, I'm always in hurry because I usually sit in my cabin and I can perform such kind of activities. Madam is very much. It's a part of an physiological
Yes,
yoga, you can
yes,
call it.
yes. Yeah, yeah,
So
yeah.
No, you can basically conclude it isn't part of yoga, which is a kind of a meditation which madam is trying to express. This is very much right. You are just
Hmm.
relieving your mind. You are just relieving, by scientifically evidence is like that. Whenever you do the exercises, your counter-regulatory hormones like cortisol, your adrenaline, these are called
Of course.
stress-related hormones.
Yes, yes.
Yes.
They decrease. The level of threshold of these they decrease, and your anti-counter-regulatory hormones they increase.
Mm.
This is the you attain the equilibrium of both of these. So you
Yes.
get a balance. So if you regularize your prayers, your activities, your daily activities, automatically, madam has what
What happened? So,
I think some network issues.
network issues.
I'm also unable to listen.
He was so yes. So he
so
shared his
so
experiences very nice. Please, network problem. Yes, please continue. Yes.
yeah, am I audible, ma'am?
Yes,
Yes,
now you
yes,
are.
yes.
Now.
Please continue.
So this depends upon a person to. You can individualize the protocol. So madam has set a one protocol, but there's a time. Somebody has a time to do this thing. Somebody is in a hurry. So you cannot. You have to individualize the protocol to the every person to person. So, for example, a person in in a hurry, see, you cannot get an. For example, it's me. I will say about me. My personal experience is like. I never operate elective surgeries. That means elective surgeries in the sense means that you have planned the surgeries in a proper way. You have encountered those surgeries in a list. Those are normal patients. But sometimes you get emergency surgeries where without any investigations, without any things, you have to operate that are life-saving surgeries. For those things, you cannot keep yourself calendarized. You cannot maintain a calendar. You cannot maintain a time. You cannot maintain a balance that you do daily. The what madam was trying to meditate to explain me, it requires a madam a particular time that you do a daily thing on that thing. So you have to individualize that time. For every profession, it's not mandatory to do that. You can individualize that 20 among the 24 hours. You can do it on at 4 at pre. For me, pre-op surgeries is okay. Post-op surgeries, that's what I'm telling. For another, we have an advocate in the meeting, I guess right now. Ritvinder is also there. She can also explain her perspective. She has seen. She must have some kind of ideas regarding this thing. Also, she must agree with me that it is a tailorized protocol. You tailorize the protocol with every individual. And madam, there was a proverb before. We used to say what eyes can see, mind cannot think. So what we do, I will definitely follow this for a couple of days. If time allows me, I'll try it tomorrow. And it's like you are trying to suppress your hormones. You are trying to suppress your level of hormone. You're decreasing the threshold of stress. Very much good. I really appreciate this. Madam.
Because these things are so important. Being a health practitioner, if your anxiety level on the day-to-day basis is more, so what will be, say, what is the age right now, Dr. Amar? Because your Bharat
Yes,
Insurance.
I am, ma'am. I will be 36 on 31st May. It's coming. My
Yes.
birthday is coming.
Oh, okay. So just 36 here, just imagine your stress level at the level of cortisol release. Now, just imagine being a doctor. If you cannot maintain your health in a way that you can serve for a longer period of time.
You are
Am I-
right. But
Am I wrong?
yes. No, you are right. But it's not only applicable to me only. Doctors, by definition, have a very short half-life. Just search some evidence research-based papers. You will
Yes.
see that among the papers, you will see our life expectancy is reduced to even you live a doctor live 10 decades before a normal person. The reason I'm telling you, even if you try to avoid the stress, a person cannot. Madam, I come by 12 night. I operate. The life is so like you cannot even say no to the patient. No, it's impossible.
Yes.
You cannot I cannot say no. I am bound to do it. I am bound to see it. I am bound to save the life. I am bound to operate a patient which has a hopes.
That is why it is more important for you. This is
Yes,
more and
ma'am.
more important and applicable for you to make such a grand programming that I will say yes to every patient. I will say yes to me. I will say yes to every family members, those who are coming to you. Just a programming means you are giving the instruction, these things, anxiety will reduce. What I feel, just you are telling for the medical practitioner, in each and every medical college, the first lecture should be how to handle stress. When people are overburdened with work,
Very
overburdened
true.
with
Very.
first thing, because it is manageable. Why you are telling these things? Because the first thing is this, you are believing that it cannot be controlled. It is out of my hand. You have seen your teachers, their stress level. You can see the other colleagues, they are in stress. There are many people, they are taking substance just to
Yes,
reduce the stress, but
exactly.
not.
Yes, 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 definitely.
Yes, but they are not, while they are consuming this substance, the time they are taking, with the lesser time, they can take the charge of their parasympathetic nervous system effortlessly, which is right here available. No substance, nothing. The only
You're
thing
right.
is this, we do not believe. To make some changes now, we first, the thing is, which is needed, your belief. What is your belief? If you believe that it is impossible to handle stress, you will never be able to do. If you believe I can reduce my stress level, just a single belief, it is not that you need to dissolve the entire anxiety. After a week, just spending 1.5 minutes, it is manageable, I feel. I will next Monday, whenever I will go, I will experience less anxiety in the scale of say 0 to 1. I'm feeling that anxiety 8. In the next week, it will be 6 or 7. At least that much I will bring, because it is very, very, very important for me first, my family members, as well as the patient. Because when you are in anxiety, you are not actually giving the 100% to your patient. Do you agree or not?
That's why I'm on this
Completely.
type of things, and I have invited you to join so that we
Because
can
to
help you.
give you 100%,
Yes,
your parasympathetic nervous system should work in such a way that you are fully focused. You may think you are focused, but with anxiety, your energy, focused energy is being drained out. You just pay attention tomorrow and give me the feedback that it actually happens. And unfortunately, the most important area, this machine, how is working, we are not paying attention. We are paying attention all the works, but works will come from whom? This machine will perform. So first, we need to address this one. How this one is working? Not 15-20 minutes is enough, more than enough, not needed 10 minutes. 10 minutes a day, I think it is manageable and worth investing.
Right. Ma'am, I think you should really join a counselor in a medical college so that even we have passed our MBBS. I have done my MD also. I did my post MD also. So I'm a super specialist right now. But
Okay,
this
sir.
guy,
very
yes.
good.
So I'm a super specialist. I'm an oncosurgeon right now. I do IVF
Oh,
practice
great.
also. Yeah. So I have passed through a lot of stages, and these kind of speeches are very motivated. When definitely I would like you to join some kind of a medical college to in a bulk where mostly the beginners, undergraduates or postgraduates who are dealing with the stress and all that. Anxiety is something different in our profession. A medico is very rarely having an anxious kind of capabilities, but stress is something different. You cannot correlate anxiety with the stress. These are two different concepts. For for me, a stress is like it's a different, and being anxious is a different. It's a psychiatrical disease. Anxiety is a psychiatry which has to be definitely dealt with the psychiatrist, which definitely leads to treatment, because anxiety can lead to a depression, which can lead to schizophrenia, which can cause a lot of things. So
Yes.
and there are definitely an anti-anxiety drugs which can, if only a
Hmm.
meditation cannot decrease anxiety, it has to be dealt by a proper specialist, that is a psychiatrist. So but the stress is the thing which you told, the stress. I think what I should on my experiences, on my, as in being a medico and an expert in this thing, I think the your topic touches more towards the stress, and as an anxiety based thing is like, you, for an anxiety, if a particularly a person having an anxiety disorders, can be classified on basis of psychiatrical uh, issues. For example, a person is having an obsessive disorder, he can have an anxiety which is absolutely not normal anxiety. A person with a depression can have an anxiety which is completely not a normal anxiety. A person with a different physiological anxiety is absolutely a normal anxiety, which defines that he is a claustrophobic. That means I am a claustrophobic. I'm fair about the closed space, and I having an anxiety when you put me in an open space, this anxiety will disappear. So this is called physiological type of anxiety. So these defines the different types of anxieties. But at the same time, when a person is having anxiety, this anxiety can lead to stress or cannot lead to stress. So we have a different topic, anxiety and a stress. It's a part and a parcel of a completely diseased person or undiseased person. So I hope you are getting my point on this way. This is just an as a doctor's point. I don't know, you are a better counselor than me, better psychologist, I can say. But I see, I see this kind of beginner topics are best if we counsel the on undergraduate, because you really need them. We need you. This I really joined this topic just to touch that. I was want to listen what kind of topic actually the madam and you are going to tell. But I really love the topic, and this will be a life-saving topic, especially in our profession. If you are going to organize it on a medical grounds, that too when the patient, when we are in a field of jumping in a professional things, like in a postgraduates, they are very stressed, they are very it leads to depression, and a lot of depressions lead to suicides. This is because of the
Yes.
yeah.
Now let me share just one last one event, Omar. That one of the girl, now she's studying in ICC school in class 9. Now that day,
Okay, madam.
that day her parent gave me a call that she's having the stress from from these things, some studies and all, and they visited 3 months or 4 months back one psychotherapist or whatever like that, and she suggested, just you said, some types of drugs, pills that you are supposed to take per day. And after consuming this, after 3 months, that particular student who is only in class 9, she's developed some small time of tumors or whatever, something in her uterus or whatever. So doctors are really, this is the cause of the side effect of those. Now do you feel that this type of medicine is the ultimate solution for this type of students or whatever?
Madam, the example you are telling me, that a drug
Yes,
is leading to the side effect to the another
yes,
way.
yes. For
There,
anxiety
there,
pills. Yes.
yes, for anxiety. I told you
Mm.
there is a grade of anxiety. When there is a stage
Yes.
one anxiety, stage two, it has been defined, it has been classified into stages. In the
Uh,
last stage of anxiety, it leads to severe depression. Severe depression is very dangerous thing
yes.
that can cause a
And
terrible life
that's
of a
why,
person.
yes, that's why this you know na, that quota, this 30 students performed suicide when they were supposed to get
Exactly.
some
This
NIT.
is what
Last,
happens, madam. This is what
but
happens.
this
This
is
is
not
because
the
of
solution. So yes, so how can you? There should be a solution. How we can
madam.
help the society? How we
Ma'am,
can help the society?
we can make a counseling classes on base of large perspective. We
Yes.
can take a counseling class. That's what I'm telling. They are the beginners where the developmental stage is going on. We are like, I am
Yes.
on that stage where I can counteract this stress. I can just divert my mind because I'm much over to handle it right now. Now, at the level of the teenage, once they are entering in the site of professionalism, where their hormones are
Yes.
fluctuating up and down,
Yes.
this is the life where adolescent, this is called adolescence age. So where there is a very risk that they can fall in the trap of drugs, they can counter-regulate it with the drugs rather than taking the other way, rather than us seeking the help from the professional, rather than seeking the help from their teacher. So every school, every college must have a counselor so
Yes,
that they
that's
can
why
counsel
national
them.
education policy, national education policy has made it compulsory for all, for from 2020.
Definitely,
That's why we
definitely,
are
ma'am.
arranging this. Yes, and
Definitely, I'm
to
very
help all, to help all. Yes.
definitely wherever definitely it's very good because in our during our times there was nothing like that.
No,
But at
no, no,
stress
it
level,
was not that.
we
Yes.
have we yes, there was nothing like but nowadays because of the stress level of more maybe the books, maybe this or maybe the competition, maybe
Hmm.
whatever. So stress
Yes. So
has
how to
increased.
save?
So these things should be there. They should definitely should be there.
Yes.
Moreover, what you said, the example of 9 years old, madam, there is
Hmm.
nothing like no. I have a on my. I mean, on my. I mean, I cannot define it on my tongue. I can say you have hundred of drugs which I remember right now. Antipsychotic does not have a single side effects on a tumor that affects the uterus. There is nothing like that. There is
Okay, so
no
the
drug.
parents are
You
saying,
prove
okay.
me one drug from the internet. I will Google all the anti-drug and epileptic drugs, antidepressant drugs, these are the antipsychotic drugs that does not no drug is like the medicine they are giving. They don't cause any kind of harms. They don't give you any kind of harms. Like they will give you malignancy in a uterus. No, that's a jargon. That is undefinable jargon thing. Whosoever has stated that is unproved scientific that's not scientific evidence. There is
Okay,
no
okay.
evidence. Yes, that there is no evidence regarding that because a tumor of uterus in a 9-year age is very rare because of our hypoestrogenic activity. These females, they even yet they 9-year old. It's very ma'am. Even you. I mean,
9 year old in class 9, class 9,
okay.
class
She
9.
is class 9. She's in class 9.
Uh-huh. Yes.
These patients have very rare kind of malignancies. One person is a malignancy in a tumor, although they can have they have a ovaries, they can have a germ cell tumors in the
Mhm.
ovaries. That
Uh-huh.
is but that germ cell tumors is not secondary due to any kind of side effect.
No, but her parents are so stressed that she is under stress and whatever they're visiting psychologists, they're going here, but no
Ma'am,
solution is
let
coming and
let
she's getting
let she
depressed.
be with a proper counselor. Let she be let a proper counselor comes in a position. Let the
Mhm.
dog. If the counselor cannot, it's a teamwork. What do you mean
Yes,
by
teamwork.
teamwork? It's a teamwork. It's not a one person who can handle the situation because of the day to days. A psychiatrist can play a role. A psychologist can play a role. A counselor can
Yes.
play a role.
So it's a teamwork. Yes. So what she has done all this on all the sectors. So that's why she is saying this can be managed with other, not by taking only the medicine is not
No,
the solution.
medicines is not the only solution because one was every time the psychiatrist to the patient, to his parent, to her parents, they say that you have to change the environment in order to change the
Yes.
situation of a patient.
Yes.
The
Yes.
first thing is you have to change the environment. You have to change that trigger, the trigger which is causing this stress.
Yes. Yes. Absolutely. Now, so
Yes.
so ma'am, yes. So what is your
Uh,
suggestion that he will continue he will practice
ye-
it for 2 days or
yes.
3 days? What do you suggest, Omar?
For whom? For
For
the
Dr. Omar.
yeah. Dr. Rama. And one more thing,
Omar.
as I am counseling one leukemia patient now. That is why I'm just asking you, since you are handling this onco cases. Its research says that the cancer, because in my family also so many deaths happen due to cancer. So they have stuck emotion. Do you feel that for prolonged emotional suppression, that emotion was not released properly? This is one of the cause, because research nowadays says that those who got cancer, they have a tendency prior to that prolonged suppression of emotion. Do you agree?
Definitely. A cancer is directly proportional to your emotional. You lose your very near ones. You lose you social. It drains you socio-economically. It's a burden on your health. You lose the person. You lose socio-economic status. You lose everything. Whatever is, and ultimately, what is the result?
No, before cancer. I'm not telling that after cancer. So when the
Okay.
person diagnosed cancer, so
Okay.
research is telling that that person, maybe from childhood or for a couple of years, the person suppressed his emotion. That means his emotion, acute
So
emotion,
you mean,
was not
okay,
released.
what I am understanding by your this quotation,
Mm,
that the person
mm.
is yet not diagnosed, he's not even knowing the cancer. This is what you mean, and before that, he already suppressed because of the some kind of research says that he is already emotionless.
Uh, Not even that, diagnosed cancer, but whenever they were questioned that how was your previous life and these things, so it was found almost everybody emotion was not released. The emotion, acute emotion, maybe anger or sadness, maybe depression, maybe they had this bipolar disorders, it was suppressed. And after that, cancer was diagnosed. One of my patients, now I am counseling from Bhopal, because I, apart from my psychology, I teach them how to heal. How to heal means there is, you can say there's our energy system in our body. It has the tremendous power beyond the physical limitation, because I always use that. So I am trying with her, although she is making all this, her treatments, chemos, and everything, but she got a tremendous result out of it. Just to heal means even uh, if we make this tremendous, use of our power of mind, that my cancer cells are getting dead or something like this, just with the power of our mind, it is a tremendously different concept, our mind. And this thing starts happening because the way we see our physical body, beyond the physical body, we are the energy body.
Okay, ma'am. Actually, I have yet not been such kind of a because I never go retrospective. Seriously, if
Okay,
so,
okay, okay.
I have never been a retrospective such kind of because for that thing you need a time, you need a research. So the I never you ask the clinical history with the patient, but related to this, we are very peculiar with the own history. What led to this
Okay,
and that. This is like
okay.
an but psychological history. I have never said how was his her emotion because already the patient is on a different aspect now. Now the requirement is of a treatment. Going
Yes,
back going back to the past history means like you are getting nothing when he was or she was not diagnosed with anything and telling it's like it's very difficult for a doctor to just go a retrospective to make a retrospective diagnosis. So that's what I'm trying to tell you.
okay.
Maybe you can play a role in this and you can publish some kind of a paper and put me second name.
Uh, no, it is already been published. It is not the, I'm not the first person. I have
Okay.
read so many publications that now the person who has come for this treatment, they were put into this releasing the past emotion along with the treatments of chemos or whatever the treatment the physicians are doing, just releasing the stuck emotion so that the treatment becomes the faster and becomes successful. That is what I want to say.
Okay.
Actually, yeah. Yeah,
You
please
just
take
Uh,
it.
tell
and
him.
one more thing, Dr. Amar, you were mentioning about the claustrophobia. I was handling one patient of claustrophobia. Have you heard about the neuro-linguistic programming, NLP?
Yes.
So
I
I
have
am
heard.
so I am a neuro-linguistic practitioner as well. So I helped her without any medication, without nothing. This
So
is a form of anxiety. How to
great.
reprogram Whenever you are feeling that in a closed space, in a lift or whatever, wherever, how to reprogram this programming should be made prior to that. And on the spot, at that time, you will just start feeling in a different way, which you were not feeling previously. So this is our wonderful mechanism here available. We are hardly addressing that. We are
Great.
And
addressing
also
the
for the
physical part, wherever the energy part, where
Great.
this is something beyond our physicality. Human being is not limited to the physicality. There is something beyond our physical body. So that is what I want to address, so that with medication, with all kinds of treatments, people can live well. I always want the well-being of people. People, whatever they do, whatever profession, whatever do they want, people just live well and
exactly.
let others also well. That's what my
Yes.
mission. Thank
Life
you
is
so
more
much,
precious.
Dr.
Thank
Omar,
you so much.
for
Thank
attending.
you so much, ma'am. Thank you seriously.
And
Thank you so much. Thank
sharing,
you. ma'am.
sharing,
So,
sharing our
if
experiences.
any help from my part, you can approach. You just feel free to approach me.
And yeah, and yes, let us close it today. And
Yes, yes,
if he
yes.
has any doubt, he can give next any type of Omar. I'll suggest you, if you can manage your time, please join, so that it becomes very interesting, because both the type of these things now, it gets accumulated and we really
Yes,
get the
sure,
benefit.
ma'am. Sure. Definitely. See, once I get.
From next Monday, that means 27, I am conducting a 5-day workshop on how to train the